Standardized care is the use of reproducible, evidence-based practices in delivering health care. When you look at the highest performing organizations across the country, most of them tend to have evidence-based protocols of care which they use, which provide over and over reproducible, exceptional outcomes for their patients. The best way to obtain that is to have standardized care protocols so that regardless of where you go at SSM, if you're in Oklahoma, if you're in Wisconsin, if you're in St. Louis, it doesn't matter because we're assured that we are providing evidence-based, consistent care, which will lead to not only exceptional outcomes for our patients, but also ensure that we're viable on the value equation, meaning that we're able to provide care at a reasonable cost, because that's as important in the future as we look at healthcare delivery. Epic is really the beginning of our ability to create standardized platforms of care. So we've already are almost close to implementing Epic across the system. The next step now is to take evidence-based care protocols and embed them in Epic. So for example, if we talk about having an acute heart attack, there are guidelines, nationally and internationally accepted guidelines of what we should be doing when somebody walks into the emergency room with a heart attack. We have embedded those protocols in Epic so that we're sure that in that urgent situation and at that moment that everything that needs to happen with that patient is happening. Not only at the moment, but also once they're hospitalized to make sure that we haven't missed anything. So what we've put together is something called the Clinical Leadership Council, which is a mixture of physicians, clinicians, hospital operators, pharmacists that are working together to create a standardized care for several disease areas. Now that we have a lot of technology enablers which make this a lot easier, in an electronic record-based world, putting standardized orders and making sure that there's compliance with them is a lot easier than doing it in a chart-based world. We need to prove it to our hospital caregivers that this is a good thing. So having analytics is also very important. But the most important thing is having the intent and the belief that protocol and standardized care based on evidence-based medicine is a better way to go. Standardization has been happening across SSM, and one great example of that is DVT prophylaxis. So deep vein thrombosis is a big problem, especially in the elderly and the infirm or people with chronic disease in the hospital. Well, what standardization ensures is that there's a protocol to ensure that we are screening everybody for DVT prophylaxis, that we're appropriately then providing therapy for those who need it, and then that therapy is standardized so that instead of looking at several different drug classes, we're honing down the amount of the types of drugs we're using so that the caregivers are able to consistently use the same drugs and also make sure that there's less room for error in screening the patients as well as giving drugs to the patients. The future of healthcare delivery is very contingent on our ability at SSM and across the nation, in fact, to provide high-value care. To provide high-value care, you need two things. You need exceptional outcomes. Taking care of the patient is still paramount. We have to make sure that every patient who we see for a well visit, for surgery, for hospitalization, gets the best and appropriate level of care. Standardization does not mean that we are not looking at the individual and specific needs of the patient. What it is saying is that there's accepted norms of care for patients based upon which then we can vary to their specific needs. And I fully believe in that, and I fully believe that by having standardization in place, it gives us actually a better ability to see how people need to be treated differently or uniquely based on their individual needs and their individual disease states. Over time, we'll see more and more movement more and more towards standardization of care, and not because it's cost effective, but more importantly because it does over and over show that standardization leads to better outcomes and healthier patients.